By way of introduction, my name is Khaled El Emam. I'm a professor at the University of Ottawa at the Children's Hospital in Ottawa. And today we'll talk about the in this webinar we'll talk about the REB Wizard tool. This tool is, as the name suggests, it's geared towards research ethics boards, and it is intended to help them do re-identification, risk assessment, and some basic kind of exploratory de-identification. The tool is available on the website, and can be used by anybody. And I'll show you the link at the end and go through a couple of examples. Before that, however, I will just give you a little bit of background on re-identification risk assessment and try to position the REB Wizard tool in kind of the broader context. So in general, when we talk about the identification, there are two scenarios. One scenario is when the data custodian wants to make a decision or do an analysis on identifiability before any data is collected. So a classic example here would be the Research Ethics Board has a protocol, and the protocol describes data that will be collected in the future, and the REB needs to make a decision on whether this data is identifiable or not, or whether the risk of identification for this data is high or not. Now this may be data that's being collected, planning to be collected as part of a research study, or it may be part of a data exchange where one institution is providing data to another institution, and the lawyers want to decide whether the data is identifiable or not, because that would have an impact on the data sharing agreement. So that's one context, when you don't have any data but you need to do some kind of risk assessment anyway. The second scenario is when you actually have data. So you have a registry, for example, data has been collected and someone has made a request to access that data, and want to do a re-identification risk assessment to determine whether the data is identifiable or not, and figure out how to de-identify it. So today our focus is on scenario one. We're looking at the situation where you do not have any data collected already, you don't have a database, and the objective is to do a risk assessment. Now, in order to do that, the methods that exist rely on analyses of census data, which is basically what we've done. These are population analyses to try to determine the identifiability of individuals in the population based on various demographic and socioeconomic characteristics, and risk assessment models are constructed based on that. So at a high level then, when we have a data set, or when we're considering a data set, we classify the variables into three groups. This is a high level classification, but it's useful. The first type of variable are the directly identifying variables. So these are variables that can uniquely identify an individual by itself, by themselves, or in conjunction with other readily available information. So things like names would be considered directly identifying variables. Quasi-identifiers are indirectly identifying variables. Generally, they require it requires more effort and time to re-identify individuals using quasi-identifiers, and they include things like dates of birth and postal codes. And then you have the sensitive variables, which are really not used for re-identification. Just a couple of things to keep in mind about this classification. One is that the boundaries between these three groups is not very sharp. There are some gray areas, but it's still a very useful distinction, because the way the data is analyzed from a re-identification risk perspective will depend on how the data are classified. So usually a determination is made at the very beginning which variables are directly identifying and which variables are quasi-identifiers. The second thing to keep in mind about quasi-identifiers is that there are really many types of quasi-identifiers. You have what are called relational quasi-identifiers, which is really the type we're most concerned with, and then you have transactional quasi-identifiers. Transactional quasi-identifiers are variables that appear many times for each individual patient. For example, diagnosis codes, where you can have many diagnosis codes per patient per visit. Drugs dispensed, same thing. You may have multiple drugs dispensed per patient. Lab results, and so on. Relational quasi-identifiers tend to be more stable over time. Okay. So some concrete examples of direct identifiers, which are commonly used, are the name, address, telephone number, fax number, medical record number, health card number, health plan beneficiary number, license plate number, email address, photograph, biometrics, social security number, social insurance number, implanted device number. So essentially unique identifiers. Some of these variables or examples come from the HIPAA privacy rule in the US, but they're generally considered to be direct identifiers, which means that if I have those pieces of information, I can uniquely and directly identify an individual. Examples of quasi-identifiers. So most of these are relational quasi-identifiers. You have sex, date of birth or age, some any geographic locations such as postal codes or census geography. The census usually defines aerial units in a different way. So in Canada, instead of a postal code, you may have dissemination areas or census tracts. Information about proximity to known or unique landmarks. Language spoken at home, ethnic origin, Aboriginal identity, total years of schooling, marital status, criminal history, total income, visible minority status, activity difficulties or reductions, profession, event dates such as admission, discharge, procedure, death, specimen collection or visit or encounter. And then you have the transactional type quasi-identifiers, codes like diagnosis codes, procedure codes, and adverse event codes, and then country of birth, birth weight, and birth plurality. So these are all examples of quasi-identifiers. In most data sets, of course, you will not have all of these variables in the data set, and whether these variables are considered useful for re-identification will be context dependent. But if you want a big list of potential quasi-identifiers, then here's one that I think covers most of the types of quasi-identifiers that we've seen in practice. Okay, so now when we want to de-identify a data set, there are really two general types of methods that are used. They're masking methods and de-identification methods. Masking methods are used to deal with the directly identifying variables. And I'm using the word masking because there's a whole industry out there of companies building masking tools. So it's a kind of common industry term for tools that deal with directly identifying variables. So all the directly identifying variables that I showed you before, they can be masked in order to make it difficult or impossible for an adversary to identify individuals using those variables. And then for the quasi-identifiers, we usually talk about de-identification or de-identification methods and de-identification tools to deal with the quasi-identifiers. So I'll talk about each one of these two different kinds of methods individually, and just to give you a sense of how they would operate. So for masking, examples of techniques that are used are suppression. So this is when you remove the directly identifying fields from the data set, so you remove them completely. And the second one is pseudonymization, which essentially means you replace a direct identifier with some unique key that cannot be reversed. You can have also reversible pseudonymization, which is useful in some cases, like in clinical trials, but for now we'll assume that we don't want to reverse them. So these unique keys may be hash values or just randomly generated numbers that act as unique keys. And then you have randomization, which means replace the direct identifiers with random values. So for example, if you have names in your data set, you would replace the names with random values, random names from name dictionaries basically, and you would do that in a way to ensure that the gender is correct. You can replace MRNs with fake MRNs that have the same format. You can replace phone numbers with fake phone numbers, postal codes with fake postal codes, or addresses, addresses, replace them with fake addresses. If you have credit card numbers, social insurance numbers, health card insurance numbers, all of these would be replaced with fake numbers that would pass the validation checksum. Um, so this is referred to as randomization, um, and is one way to deal with directly identifying variables. Uh, which one of those three should be chosen will depend on the context. In some cases, you do want a pseudonym um, because of the type of analysis that will be done. For example, um, if you want to be able to, if you have longitudinal data and you want to be able to group records that belong to the same patient together, then you'll create a pseudonym for the patient to allow that longitudinal linking to occur. And whether suppression is used or randomization is used will depend on whether you need the data set in the for your analysis. So if, for example, if you're giving data to a software testing group, which is a common scenario, you have a group that's developed some applications and they need to test it, then you would use randomization rather than suppression, because the testing group would want realistic data with all the fields intact in order to do their testing. For most of research purposes, suppression would be used. So a combination of suppression and the creation of pseudonyms would be used in order to release the data or de-identify, mask the data. So which methods used will depend on the context. And then the last masking method is adding noise. And sometimes people add noise to data. So noise is a little bit controversial because there are methods to filter noise out of data. I mean, in the field of communications, there's a whole century worth of work on building noise reduction and noise removal filters from communication channels. And if you apply those techniques to, in this case, then if someone adds Gaussian noise or even non-Gaussian noise, you can construct some pretty powerful filters that will quite accurately remove the noise from the data. So the addition of noise is, or random noise from some distribution is not recommended. To do it right is quite complicated, and with the right person there, they can apply the filters to remove the noise and extract the signal. So these are generally the masking methods. So if you're reviewing a protocol and you see some variables that can be classified as directly identifying variables, then you would apply those masking methods to them in order to make it difficult to identify the individuals. The next point that's important to understand is that masking is not enough. So even if you apply masking, so let's say in the REB context you do not collect names, so that's a kind of suppression, or you immediately replace names with pseudonyms. If you do all of these things and mask the directly identifying variables, this will not be sufficient. It's important to be able to deal with the indirectly identifying variables or the quasi-identifiers. And the reason for that is it's quite easy to re-identify individuals from the quasi-identifiers, and I'll show you why. So I'm just gonna okay, so on your screen you'll see a graph, and this graph, I'll just wait for a few minutes, sorry, a few seconds to let everybody's screens update. This graph was constructed from a study that we did with our colleagues at McGill. It's based on data from around 1 million Montrealers over an 11-year period. And what we did was we obtained their basic demographics over that period. So we obtained their date of birth, their postal codes at the beginning of every year, and their gender. And what I will do here is focus only on adults. So on the x-axis of this graph is the postal code. So if you have 1 up to 6 character postal codes, for those individuals. And so we used, so this represents about 25% of the population of Montreal, and we use that to make estimates for the whole population. So these are really population estimates that I'm talking about now. And so the x-axis, you have the postal codes from 1 to 6 characters, and then let's look at the date of birth. So these are for adults, so we defined adults as 20 years old and higher. So as you can see here, that on the y-axis is uniqueness, which is the extent to which the individuals are unique in the population. So as you can see, the full date of birth and the 6-character postal code make 99% of the population unique. I'm comfortable generalizing this to other urban areas in Canada because they have similar kind of distributional characteristics when it comes to geography and distribution of demographics in those geographies. It's not so straightforward to generalize to rural areas because they tend to be larger and have more people in them, rural postal codes. So let's just talk about urban areas across the country. 99% of the population is unique on their 6-character postal code and their full date of birth. Why is that a problem? Well, the problem is if someone discloses a database and there's a date of birth and a postal code in that database, and if I know my neighbor's date of birth and postal code, and I find a matching record, then I'm almost certain that I've identified or re-identified my neighbor's record in that database. So it makes re-identification very easy to do when individuals are unique. Now also, as you can see, if you reduce the precision to a 3-character postal code and full date of birth, still about 80% of the population is unique just on those 2 pieces of information. If we add gender, things jump up a little bit, so now 99.3% of the population are unique on date of birth and postal code. But generally it's the date of birth and postal code that make the big difference. Gender really makes a small difference. If we generalize the date of birth to, let's say, the year of birth, so if you have the year of birth and the 6-character postal code, then about 79% of the population are unique on on those 2 pieces of information, and the gender, of course. So you have year of birth, gender, and 6-character postal code. 79% are unique. If you have a 3-character postal code only and the year of birth, almost 0% are unique. So the main point here is that on basic demographics, very simple demographics make individuals unique in the population, which makes them very easy to re-identify. And as you generalize or reduce the precision of those variables, then the uniqueness goes down as well, right? And it doesn't take many variables. So the basic demographics can make individuals unique in the population. The numbers in the U.S. vary for date of birth, zip code, and zip 5, that is, and gender. Between 63% and 87% of the population is unique in the U.S. on these variables. The difference between Canada and the US is mainly because zip codes or zip 5s tend to be larger than postal codes, so they're not as precise. But postal codes, Canadian postal codes, let's say in residential areas, you may have 20 houses or so, 20 dwellings, making it the number of people who live in a zip code can be quite small. So they're quite precise geographies. So because demographics can make individuals unique, the re-identification risk can be quite high even if you mask. So masking is not sufficient because these residual variables make individuals unique. So now the next obvious question is, okay, so what? So what if basic demographics or the socioeconomic variables make individuals unique? I mean, how easy is it for us to get this kind of information? What are the plausible methods of attack on this kind of data? So there are really 2 scenarios. The simplest one is where an adversary, who's a nosy neighbor, a coworker, a relative, ex-spouse, who gets hold of the database, they will know the basic demographics. These individuals, let's call it this, the nosy neighbor scenario, these individuals will have that background information. They'll know the date of birth, they'll know the postal code, they'll know the gender, they'll know any visible characteristics, they'll know language spoken at home. So under that attack scenario, those people will have that knowledge to re-identify individuals in the database, and if these variables make individuals unique, then the re-identification will be with certainty. If you don't have that data in a Canadian context, it's possible to get this information from public sources. So I'll just go quickly through a couple of scenarios where you can get this information from public sources. Examples of public source, and this is Canadian only. In the U.S., there are more public sources in the U.S. Um, so this is really specific to Canada. And in a Canadian context, then basic demographics about individuals can be obtained from obituaries. So if you're looking at, say, adverse drug event data, where you have the adverse event being death, then you can match that with publicly available obituaries and re-identify individuals. And this has happened before with Health Canada and a public broadcaster here. So obituaries are available from newspapers, and now they're on the websites. There are obituary aggregation websites that combine obituaries from multiple local newspapers, so you can do some pretty broad meta searches across large regions. Then you have the private property security registration, which contains information on loans secured by property, for example, cars and boats. So the PPSR is available in all provinces across the country. The mode of access differs, but it's available, publicly available for a fee. In Ontario, the fee is around $8, and for that fee, you can do a search. When you do a search, if a record of that individual exists, then it'll give you their exact address, their date of birth, and of course how much money was borrowed, what the property is. If it's a car, then it'll be the vehicle identification number, how much money is owed on the car, etc. And these are all public registries. They also have land registries, which have information on house ownership. Other kinds of public sources are membership lists. So for example, doctors, lawyers, and civil servants there are public registries that maintain lists of these professionals. In some provinces, teachers also are listed in public registries. You have salary disclosure reports, which lists members of public sector employees. And I'll show you now why that information is useful. You have white pages, you have job sites, which are public or not public, where people post some very personal information. A few years ago, we did a study looking at what Canadians post in their public CVs, and we found that they post a lot of information that would make them unique, like their date of birth and address, that they post on public sites. And of course, now you can get that information from places like Facebook. Donation disclosure forms for political parties include names and addresses. Sports rosters include detailed information about team members, including their, of course, dates of birth, location information, as well as other very precise measurements on dimensions. And then, of course, people post a lot of self-revealing information on Facebook and other social networks. So these are all public sources of information. Now, how can these be used to gather demographics about individuals? Well, I'll give you a couple of examples. I just wanted to make one point about voter lists in a Canadian context. So people often talk about voter lists and how they can be used for launching re-identification attacks. This is certainly possible in an American context. Many states make their voter lists available, although some states put restrictions on them in terms of who can get access and for what purpose, and fees. They're not all free. Some states make them free, and some states require some pretty hefty fees to get access to their voter lists. But they are generally available for many states. In a Canadian context, you cannot legally use a voter list for purposes outside of an election. However, there are known cases where a charity allegedly supporting a terrorist group, the Tamil Tigers, was found by the RCMP to have obtained Canadian voter lists, and they had highlighted the names of individuals with Tamil-sounding names, and they were being targeted for donations. They were raising money. So they would find people who sounded like they would be sympathetic based on the ethnicity of their names, and they were targeting them. I mean, I did speak to some people in that area who were approached by people who wanted to get the voter list, and these were essentially volunteers in elections. Volunteers in elections get the voter lists, and in this case in Scarborough, they were approached by this group, and they were asked for voter lists. So generally, volunteers get the voter list, and there are few restrictions, at least until recently, on how they handle them. Legally, they can't, but has not been strongly enforced, at least until recently. However, if you want to get a voter list in Canada, you can just nominate yourself In election, it's not very expensive, and it's not very burdensome to nominate yourself as a candidate and then obtain the voter list. However, voter lists do not contain dates of birth. So the whole voter list scenario is not a very good one because first of all, it's not legal, and it's not that straightforward to get access to it. I believe Elections Canada has been cracking down recently, and uh, generally the voter list in Canada do not contain the date of birth. There was an attempt to include dates of birth in the voter list, but that failed. So as of now, voter lists do not contain date of birth. So not really a good source of information for these kind of identification attacks as they may be in the US. However, you can use other public registries in Canada to get the demographics on individuals. And the basic process is as follows. Let's say we want to launch a re-identification attack on physicians. So we'll go to get a membership list for all physicians. Let's say the College of Physicians and Surgeons of Ontario maintains a public registry of all physicians, so we get a list of all the physicians. We'll do searches in the PPSR, the Private Property Security Registration, and then cross-reference with the white pages. What that will allow us to do, once we have the name, we can do the PPSR search, and from the PPSR we would get the home address and the date of birth. Now, which kinds of groups have these membership lists? The College of Physicians and Surgeons of Ontario, as I mentioned, Law Society of Upper Canada, Professional Engineers Ontario, College of Occupational Therapists, College of Physical Therapists, Public Servants, in a database called GEDS. So there are multiple sources of membership lists. Now, remember, if I have your date of birth, a date of birth and a postal code and essentially a unique identifier, if I find any record that matches, I'm almost certain that it's that individual. So we did such an exercise a couple of years ago with lawyers and physicians in Ontario just to determine how easy it is to get the basic demographics from these public sources. So the ability to get home postal codes for physicians was 60% and lawyers was 45%, and then date of birth was 40 and 45% respectively. So for about 40% or so, we were able to get the basic demographics that can be used to re-identify individuals in a database, the demographics that would make these individuals unique. And of course, there's a difference between males and females. It was easier to get the information for males compared to females, and part of it was there are more records with males in the PPSR than there were for females. But I mean, the main key things here are the postal codes and the date of birth. So for male doctors, 63% of them we were able to get this. Now, what we did is we took a random sample from all physicians. We didn't actually do it for all 23,000 active physicians because at $8 a pop, this would become very expensive quite fast. So we allocated a small budget of a few $1,000s and selected a random sample and went through the exercise. So these numbers are based on a sample, and this study has been published. So the other type of individual that can be re-identified are homeowners. So again, if I want to target people living in homeowners in a particular area, let's say I have a particular postal code, I would go to Canada Post, get a list of all the households in that area, in that postal code. Once I have a list of all the houses, I can go to the land registry and get a list of all the homeowners. And then once I have a list of all the homeowners, I can do PPSR searches to get the dates of birth of those individuals. So I'd have the names and dates of the names, addresses, the full postal code, and the dates of birth of these individuals, cross-check with the white pages. The other point to make is in cases where we don't have the gender, there's some very good genderizing software which will take a first name and predict quite accurately the gender of the individual. This software is used for marketing, and we actually we did a study on the accuracy of genderizing software, and we found some that is remarkably accurate. So even if you don't have the gender but you have a name, you can derive the gender quite accurately from using that software. So again, going through this exercise, we can obtain the basic demographics for all the homeowners in a particular postal code. So we did that just to find out how well it works for one postal code in Ottawa and one postal code in Toronto. And the ability to get date of birth was between 33% and 40% of the homeowners. And the ability to get gender was 87 to 95%. So sometimes the genderizing software is not certain. It's not able to determine whether it's a male or female, but the hit rate is quite high. And this was for a postal code with 15 and 20 dwellings respectively in Ottawa and Montreal. So again, we can target specific homeowners in specific regions, get the demographics to launch re-identification attacks. And the last example I will use are the civil servants. So these are, in Canada, federal civil servants are listed in a database called GEDS. It's Government Electronic Directory Services. There are 386,000 individuals who work for the federal government in Canada. According to Statistics Canada, GEDS has about 170,000 entries, which is just under half. Some federal departments do not list their members or their employees in GEDS for obvious reasons like CSIS, the RCMP, and any other DND and other departments related to law enforcement. So, but still, there's 170,000 entries. So we did an exercise where we selected 40 individuals who worked at the Public Health Agency who were living in Ontario, and we went through the same exercise. We went to GEDS. We did searches on PPSR to obtain their date of birth and postal code, and we're able to get the full postal code for 50% of them, and the date of birth for about 22.5% of them. So, I mean, again, it's not everybody who can be we can get the basic demographics for using these methods, but a large enough proportion of individuals that we can be used for re-identification attacks. Provincial governments have similar sources as well, which lists employees. So the point here is that with the basic demographics, because they make individuals unique, and of course the more demographics and the more socioeconomic status variables you have about an individual, the more unique they become. If we're able to get that information, then we can start matching with any database that's released, right? And so this is why the quasi-identifiers are problematic, and they also need to be dealt with. They need to be de-identified. So masking is not enough. It's necessary, but it's not enough, we need to deal with the quasi-identifiers. So now I'll just walk through a couple of examples, or one example mainly, of how the REB Wizard tool can be used to manage this risk. So the last slide showed you the REB Wizard link, and it's available on our website, and this is what it looks like. And I'll just go through a quick example to illustrate, and then I'll come back and walk you through an interpretation of the results. First of all, I would strongly suggest that you, up on the top right hand side, there's a user manual. I would strongly recommend you go and download this and read it. It's got useful references and information about how to use the tool and how to interpret the results. So the first step is you need to select the region of the country you're interested in, because the results are different for different parts of the country. So I'm going to select Eastern Ontario here as the region we're interested in. So this tool is built on a model that we developed by analyzing census data, and the model has been published. It was published a couple of years ago, and the model essentially predicts uniqueness. So up here you specify how many characters in the postal code you are interested in. So you can change it from up to 6 characters in the postal code all the way down to 1. I'll just keep it at the default of 3 characters in the postal code, and then here you specify the variables that you're collecting. So there are a number of variables that kind of basic demographic and socioeconomic type variables that are listed, but you can also enter your own if the variable is not in the list. So you can go here and enter my variable, for example. Just for the sake of making this concrete, I will keep this as gender. So here we have gender, and gender has 2 possible values. and then the next variable is age, and again you can select from other possible quasi-identifiers: language, ethnicity, total years of schooling, marital status, religion, total income, whether the individual is a visible minority or an aboriginal status or not. So I'll just keep it to age, and I'll add another row, and let's add language spoken, and let's say there are 5 possible languages that can be spoken. So by filling up this table, we're specifying the variables that are going to be collected. Now you can determine that from reading the protocol. So the assumption here is you have a protocol, and you have some specification on the variables that will be collected, and so this is what you provide. You provide the geography, that the aerial unit basically we collect data about. So in this case is the forward sortation area, the first 3 characters of the postal code, and the list of variables that you will collect data about, as well as the number of possible values. And then we submit, and what this will do is it'll perform an analysis and give us the population at risk for the K region that I had specified. Okay, so as we can see here, about 34% of the population in the K region in Eastern Ontario are at risk from if we collect data at the 3-character postal code unit, and gender, age, and language. Okay, so just a little bit of background. What we found when we analyzed census data is that the number of possible values that a demographic variable can have was a very good predictor of uniqueness, because really we're looking at uniqueness here. So in this case, if you look at gender by age by language, there are 900 possible values there, right? You have 2 by 90 by 5, and this was consistently a very good predictor of uniqueness in the aerial units that we were looking at, whether it's the full postal code or the 3-character postal code or the 2-character postal code and so on. And it did not matter which demographic and which socioeconomic variable we were looking at. So the census has about 15 variables that are collected that can be classified as kind of classic quasi identifiers. And it really didn't matter which combination of variables we were looking at. We always consistently found that the number of combinations was a very good predictor of uniqueness. So this is essentially what we're doing. We're using the number of combinations to predict uniqueness, and we've constructed models to that effect. So what we find here is that in Eastern Ontario, 34% of the population lives in areas where you will have individuals unique on these 3 variables only. And in terms of a map, here's a map showing where those people live. So the kind of reddish-brown areas on this map indicate where those high-risk people live, and we can superimpose the cities here. So as you can see, most of them live in urban areas, and right, you can zoom in and take a closer look. Essentially, the highlighted areas are where these high-risk areas. So if you're collecting data from those areas, then this is where the high-risk individuals live. Now, of course, this risk is high by most standards. 34% of the population being high risk would not be acceptable. So then you can go back and start playing around with, well, if the risk is too high, how can we make it low? How can we make it acceptable? Well, one option is to reduce the precision of the variables that you're collecting. So instead of collecting age in years to 90, up to 90 years of age, you can group them into groups of 5, and now you'll have 18 possible values. And then you can go back and redo the assessment, and in that case you have about 7.3% of the population live in high-risk areas, right? Or 7.3% of the population are at risk. If that is not acceptable, then again you can go back and say, well, maybe we'll reduce the precision of the geography. So we'll change the postal code digit to 2 characters and age to take it back to 90 years of age, and then let's see what the population at risk would be. Here we'll see that 0% of the population are at risk, live in areas with uniques in them. So through this process, you could do a risk assessment. I mean, it's general, it's broad. In the sense that you're looking at whole regions, but it gives you a sense of where the risk is, or how high the risk is and where the risky parts are, because it's not uniform across the whole area. Some parts will be high risk and some parts will be not. Um, Now, a couple of caveats about this analysis, of course, is that uniqueness was only one measure of re-identification risk. It's a very commonly used measure of re-identification risk. Is used by statistical agencies, has been used by statistical agencies for a number of decades. However, more recently, other and different re-identification risk metrics have been developed. So generally, uniqueness tends to be conservative in the sense that if uniqueness is very high, then re-identification risk will also be high on most of the other metrics that exist out there. So if it's high with this tool, it's going to be high whatever metric you use, right? Because uniqueness really is the starting point. If it's low in uniqueness, then it may be high. Risk may be high on other metrics. However, if you decide to use uniqueness as your re-identification risk metric, then this tool will give you a sense of how high the risk is. Now, this tool is experimental in the sense that we're hoping to get feedback from users in terms of what functionality and what features are they would like to see. We have actually a more comprehensive version of this tool that have a few more capabilities, so you're able to export all of the postal codes, for example, that are high risk and low risk. So if your target is only a specific catchment area around a hospital, let's say, then you'd be able to export the postal codes, and only look at the ones that are inside your catchment area. These are not included in the publicly available tool, but again, if we get feedback saying this would be really useful, we really want to use this, then we'll be able to kind of justify the effort and expense in making these features available on the online public version. And the other capability that exists right now, we classify areas where uniqueness is higher than 0% as high risk. We have other models where if uniqueness is higher than 5% and higher than 20% are considered high risk. So for some of the cancer registries in the US, they've used those other thresholds where they said, for example, we will accept uniqueness as high as 20%, but only for trusted researchers. So they classified their end users into trusted researchers, not so trusted, and public. So public gets the 0% threshold. The trusted researchers get the 20% threshold. So up to 20% of the population can be unique, and it's considered safe. So we have models for those as well, for the 5% and 20% uniqueness threshold. Again, if there's a strong demand for this capability and people see it as useful for risk assessment, then we will make that investment to make it available. And the other thing to keep in mind is that the results will be different for different parts of the country. It's not completely uniform. For example, New Brunswick has a lot of rural areas, so you'll get a very different result in New Brunswick, let's say, compared to Ontario, for example. So it does matter which part of the country you're looking at, especially as you add more and more variables. The other observation is that it really does not take a lot of variables for uniqueness values to be high. So this is something to keep in mind. And a strong driver of that is the number of characters in the postal code, right? So the more precise the postal code information, the faster the uniqueness levels will go up. So you have to do the trade-offs, and with a tool like this, you're able to do these trade-offs explicitly to determine geographic precision versus more detailed variables, and based on that, decide whether the risk is acceptable or not. Which brings me to the whole issue of acceptable risk. What is acceptable risk in terms of percentage? So let's go here. In terms of percentage of the population at risk, as I mentioned before, there are precedents for 20% uniqueness as being acceptable for trusted researchers, 5% for not trusted researchers or occasional users, and 0%, which is what we have here, for kind of broader use with fewer restrictions. But each organization that uses this tool would have to make its own decisions regarding what's acceptable risk and what the percentage thresholds would be. for them to release data. So we're hoping that this would be a good starting point to get organizations to do risk assessment, identification risk assessment, and understand how to make those trade-offs. The underlying model, we are of course updating it. Statistics Canada released the 2006 census recently, about a year ago, so it is in our plan to redo the analysis on the most recent census and update the underlying models over time. And finally, the final point I wanted to make was that regarding the US, we are constructing a similar tool for the US, which will provide risk estimates or uniqueness estimates, well, actually risk estimates, not just uniqueness, estimates across all the states in the US, and we're hoping to launch that in sometime in kind of mid to late March of this year. So we've put a placeholder there, but the concepts and the ideas will be quite similar to what you're seeing here for the Canadian REB Wizard. So with that, I will stop, and we have about 10 minutes or so left. So if you have any questions, please type them on the in the chat box, and then I'll be able to see them and respond to you. Okay, see someone typing here. Okay. So the question was, is 0% risk of identification really zero? I mean, these are estimates. So we did validations of these estimates using kind of standard cross-validation methodologies, and the models are quite accurate. So is it exactly zero? Probably not, but it's close to zero. But again, I'd have to kind of caution that these are estimates, although the analysis we did suggested that the estimates were quite accurate, but they will not be exactly zero. They'll always be a little bit higher, zero. So it'll be close to zero, but not exactly zero. So I mean, and this changes over time as well. I think you should interpret this as being a starting point for your analysis to give you a sense of how high the risk is. If you choose a threshold of what's acceptable risk and you make a decision based on this, then at least you have some objective basis to make that decision. I think the general problem we see today is that decisions are being made without any models or any data to justify them. I think the models we have here are quite accurate. They're reasonably accurate, and certainly a big improvement over not using anything. So that's kind of how we've approached this. But at the end of the day, it is an estimate. Any more questions? Okay. So the next question is, are there any Canadians? Sorry, having a little problem with my thing here. Okay, are there any Canadian reports of standards of acceptable risk? There are no specific standards within Canada for acceptable risk, although there are many precedents. So, and the precedents come from Privacy Commissioner orders. So we reviewed many of those, and in Ontario and Quebec, for example, they've made a number of orders where they've provided some guidance on what is acceptable risk. There have been court cases as well that have provided kind of precise thresholds or guidance about what is acceptable risk. And there have been policy documents from government departments and ministries of health where they've made some again very precise statements about what is acceptable risk. So I think if one is willing to rely on precedent, then there is a lot of precedent and some consistent and strong precedent that can be used to guide what is acceptable risk. Um, and these precedents go back 15, 20 years, so they're not recent precedents. They are quite well established precedents that have been around for quite some time. Um, so and we've written a number of articles around this issue as well. And if you go to our website, we have a number of reports that review this literature and provide references to what those precedents are. As well, of course, there are American precedents. As I mentioned, U.S.-based cancer registries have used some thresholds that they employ to guide their judgments about risk. How are variable values recategorized? That's the next question. So I'm not 100% sure. I understand the question. We've categorized the variables as direct identifiers, quasi-identifiers. So let me take a stab at this. The direct identifiers are variables that can be used to identify individuals directly with minimal effort or with very little effort. So that and so that's why you have names and full addresses and social security numbers and so on. It doesn't mean it's completely effort-free. For example, John Smith is a common name is about 290 individuals in Ontario called John Smith. So the name by itself does not necessarily make an individual identifiable. However, the name with some address information would make an individual identifiable, or a name, yeah, and then you look in the white pages and you can get the individual's address. So and there's a lot of history again on what's considered a direct identifier. Quasi-identifiers are pieces of information or variables that can be used to probabilistically identify individuals. Again, there's a lot of precedent in history in what are considered quasi-identifiers. The line between those two is not very clear or precise all the time. I mean, sometimes address information or postal code information is considered a quasi-identifier. Sometimes it may be considered a direct identifier depending on the context. So there's a little bit of judgment there. Sometimes even some information like diagnosis codes are considered quasi-identifiers in one case, and then considered as sensitive variables in another case. So there is a bit of judgment. There is a bit of gray between the different categories. Okay, so the clarification from the same attendee was when you change 5 language values to 3, what does your program do? Okay, so when you change from 5 values to 3, essentially we're saying that the language values have fewer response categories. So this is the number of response categories. So let's say 3 would be French, English, and other. And 5 would be French, English, Mandarin, Portuguese, and other, right? So we're essentially describing the number of response categories that exist for this particular variable. And based on the number of response categories, then uniqueness is estimated. As I mentioned before, when we analyzed the census data, we found that the most accurate predictor of uniqueness was was looking at the number of response categories that the variables had. And because we use the census data, this took into account the actual distribution within the population. So we didn't assume a uniform distribution. The actual distributions were taken into account in the data set. But we found that this was really the best predictor. We tried many, well, not many, but a number of different metrics to predict uniqueness, and this always turned out to be the most accurate one for kind of your typical demographic and socioeconomic variables.